I've been a nurse about 13 years now, and I started out in a rural hospital. That really prepared me for a good foundation in nursing. I then went into specializing in OB and then eventually hospice. I really have loved all of it. About 5 years ago, I felt just this pull toward aesthetic nursing, and I just had such compassion for people who had skin issues because I had suffered with skin problems since I was a teenager. So I just had this dream that I wanted to help people with their skin. So I set up a time to talk with a nurse who was already in this field, and she answered all my questions, and I got great information, and I was really excited about the opportunity to potentially move in that direction for my career. And at the end of our conversation, she just said to me, you know, I have to be honest with you, you probably won't ever be successful in working in aesthetic nursing because your skin is just so bad. You won't have clients that'll trust you to handle their skin. I was grateful that she told me. I am really grateful, however, that now I am an aesthetic nurse at Essentials Wellness, and that I am working and helping people with their skin. And not only that, but I've been able to correct so much with my own skin, primarily for me using microneedling and PRP, which is platelet-rich plasma. It's a procedure that I'm certified in. It's an amazing way to have your body help heal itself. My own skin problems started when I was a teenager, but when I went off to college, it got really severe. And at that point, I started sort of down the road of multiple dermatologists, multiple medications, orally, topically. I tried everything. And there are a lot of well-meaning people out there that, you know, offer up suggestions, solicited or unsolicited, saying, well, you should just try oatmeal. That's what worked for my son. Or you should use apple cider vinegar. That's all you need. Or you need to be on a ketoacidotic diet. Or you should be gluten-free. You should be dairy-free. And honestly, I have tried all of it. It didn't cure my acne. I had probably some of the worst acne in my life after a miscarriage. And I was an OB nurse, and I had no idea that that was gonna happen. That was a really painful thing that I had gone through miscarriage, and now suddenly I just had tremendous acne. When I came to Essentials, I started using the pharmaceutical grade products for cleansing my skin, and I found the difference was it wasn't all about just drying it out. I think so many times we have products that we use that just make your skin so dry and so flaky, and it ends up doing the opposite of what it should. So I'm using things that are good for my skin, antioxidants like vitamin C and vitamin E, those kinds of things that will help promote healthy skin. And then at the same time using procedures like microneedling that tells my skin, injury has occurred, let's fix it. And so when we do these micro injuries and the skin says, oh, I need to go to work now, it sort of rejuvenates itself, and it makes it, it increases the collagen and the elastin. The PRP procedure takes my own blood, my own platelet-rich plasma, PRP, and I inject that under the skin, and it does the same thing. It tells those platelets that have many growth factors, and just they're like little miracle powerhouses for the skin. It tells them it's time to go to work. And what it does is it smooths out the skin, whether it's aging or acne, or in my case both, where it feels like now my wrinkles are connecting the dots. It's actually rejuvenating the skin to the point that those scars are beginning to diminish. We have the word wellness in our name, Essentials Wellness. That's really our focus, is wellness and healthy skin. And I am excited to help people see improvements in their skin, especially for my fellow sufferers with acne. You know, society tells us as women and as men, but particularly because I'm a woman, I can relate to this statement of we're supposed to embrace those things that have happened to us as mothers, like stretch marks and acne scars, and that's true. If you hear nothing from me in this little segment, it's that our physical appearance has nothing to do with our value. We have value because we're human beings, period. And it has nothing to do with our physical appearance. So all of that is true. If we have stretch marks and we have acne scars, or we have extra pounds, or whatever it is that we have because we've gone through things in life that have brought those things on, there should be nothing in our self-esteem or our value that's affected by that. But we also have society that tends to look at us and think, well, she's not washing her face enough, or she's eating too much greasy food, or she must eat a lot of chocolate. We have just different statements that people don't realize are judgmental, and they may not know that this person is washing her face 50 times more a month than they are. All of those people are well-meaning, and at the same time, those suggestions that are made, sometimes they impact us and make us feel a little less than. They can impact our self-esteem and how we feel about ourselves. So as important as it is to know that your value is not determined by how great your skin is, it's also important to know that there are things that we can do to help improve the texture of your skin, and just how you feel about your skin. And in general, when we feel better about our skin or our physical appearance, we're just going to kind of live life with a little more confidence and a little more joy. I'm not a better person because my skin looks better this year than it did last year, but I just feel a little more confident. I feel a little less uncomfortable if someone touches my face. I had a really emotional experience last week. For years, I went to a church in my faith tradition where on Ash Wednesday, they would put ashes on our foreheads as a symbol of just accepting our own mistakes and our own blemishes, really, of life, that we're sorry for those things that we've done that have not been real stellar. And for the last probably decade or more, I was on a worship team at my church. And so while they did this tradition, I escaped. And I was glad. I didn't have to have someone putting ashes on my forehead. And the reason was not because I didn't want to experience that tradition. It was because I was embarrassed of my skin. And I was horrified at the thought of somebody touching my forehead and feeling the bumpy texture, or if I had acne on there at that point, that I just didn't want them to touch it. And how ironic is it that it's about a blemished heart, that I couldn't, because my blemished face, it's just, the irony is astounding. But this year, I had ashes put on my forehead. And I didn't even think for 1 second about, oh, I'm embarrassed of this texture of my skin. I didn't think about this poor person that has to touch my face and put ashes on my forehead. And there was freedom in that. That's my hope as a nurse at Essentials Wellness, is that I can help someone gain just a little more freedom from that feeling of insecurity. I find joy and gratification in helping someone find that freedom that I had last week when those ashes were put on my head and I didn't have to worry or feel embarrassed or uncomfortable. So